Good afternoon. Thank you for being here. I want to thank Tom for taking time out of what I'm sure is an incredibly busy schedule. And thanks to the presenters for summarizing the research in this area. Most of all, I want to express a special thanks to David Altman, who's standing back against the wall there, who is the director of the Substance Abuse Policy Research Program. For the last 14 years, his vision and leadership have made SAPRI a program of which we at the Robert Wood Johnson Foundation are incredibly proud. Under David's leadership, the program has supported more than 360 grants that have resulted in more than 2,000 scientific papers, hundreds of book chapters, and 20 books, all building the evidence for policy interventions. The research agenda for the future that my colleagues have presented today is the Foundation's way to leverage its investment in reducing the harm caused by substance abuse. When this initiative began, we set out to develop a program that would build a strong evidence base about what works and what doesn't in substance abuse prevention and treatment, not just for the sake of knowing, not just for the sake of sitting on the shelf in some journals or sitting in some books, but to drive public policy, to help ensure that decisions that you in this room make are informed by sound science, and to be honest about what we don't know, where the evidence isn't strong and doesn't support conventional wisdom. Over the last 14 years, we have seen this program do just that. Policymakers across the country have looked to SAPRI research as they considered measures like the Clean Indoor Air Law in New York City or substance abuse provisions in the federal welfare reform. A recent poll by the Open Society Institute found that 3/4 of Americans want to see that health reform include the accessibility and affordability of treatment for drug and alcohol addiction. That's not surprising, especially since 3/4 of those surveyed also indicated they personally know someone who struggled with addiction. And because SAPRI's work, we know a lot more than we did 15 years ago about what it takes to treat addiction. We need to look at addiction like other chronic diseases, like diabetes and heart disease, and incorporate both prevention, screening, and effective treatment into a continuum of care and services. As you all look forward to the implementation of whatever health reform bill gets passed, it'll be critical to look at the evidence of what works and what doesn't, particularly in the time of scarce resources. There's no reason to invest in interventions that we know don't work. In a lot of areas, if you've heard today, there's a great deal of evidence, a great deal of strong evidence about effective prevention and treatment. This program started with a narrower focus on tobacco policies, and we've learned a tremendous amount about effective strategies to reduce tobacco use. Things like encouraging healthcare providers to counsel their patients, especially pregnant women, regulating marketing practices, passing clean indoor air laws, and increasing prices and excise taxes. You've heard from the panel members the evidence from other areas, and you can get further details in the four publications that we handed out outside. We still don't have all the answers. There's still work to be done, and the landscape still continues to change. We're seeing new avenues for marketing tobacco and alcohol to techno-savvy kids. At the same time, we see health reform as an opportunity to change the way that treatment is paid for and delivered. I'm proud to celebrate all that this program has accomplished, the many questions it has answered, and the many positive policies it's influenced over the last decade and a half. I'm proud to be associated with an evidence-based policy-making efforts, and I look forward to seeing the field dig deeper and learn more about the key questions that the speakers have laid out for the future. Let me turn it over to Tom to take your questions.